Thank you for being here.
Thank you for having me. I will say that because I give back to my community. And the majority of my work history has been working in community outreach, community education. My degree is in educational policy studies from UWM, UW Milwaukee. I started off at MATC and transitioned to UWM, and I have a bachelor's degree with them. A lot of my work has been, as I indicated, in outreach. I've worked for the Boys and Girls Club, MPS, Planned Parenthood, SEIU. As you know, community outreach work comes and goes. Sometimes it's based on funding. Sometimes it's just based on the position that's available. And so I've had a lot of experience in outreach and education, and it's one of my passions. I love sharing information. I love sharing the good word about all the resources that are available in Milwaukee and all the positives that Milwaukee has to offer.
And I know earlier when we were just getting to know each other a little bit, you told me you were a mom and you're
Yes, I am a mom of 2 adult children. I have 2 grandsons and I have 4 surrogate grandchildren that I have. Just my daughter has 2 godchildren, and my sons, my grandsons have a sister and a brother. And so those are my surrogate grandchildren, and I hold them all dearly to my heart. I am an active member of Sigma Gamma Rho Sorority Incorporated, and so that is another layer of giving back to the community that I love.
Mm-hmm. Thank you.
Thank you.
I'm going to be quiet and let you share your wisdom. One thing Barb may have told you is we think it's really important to listen to the voices of people who are most impacted by injustice. And so for the last 2.5 years, we have been graced by people who have a passion for social justice. One of the questions we've begun with is, could you tell us, when was your movement birthday? When do you feel you joined the movement for social justice?
I will say, probably back in the 80s. And it probably started off with the work that I do in my neighborhood as a block watch captain, or just as a block representative, planning events for the block to build community, but then also working on any issues that we may have had, such as garbage or noisy neighbors. I used to be a community organizer for Sherman Park Community Association. I have been trained at the Midwest Academy for community organizers. And so my passion probably started back in the 80s, like I said, representing the neighborhood that I lived in. And then it just grew and fostered from there.
Mm-hmm. That's powerful stuff. I went to a Common Ground University 101, and one of the things they were talking about is we are organizers. We're not just activists. Yes. We don't do action for action. We look at what are the needs of the people, how can we mobilize and listen to them, involve them in leading and following, and collaborate together to make an impact. And so Common Ground right now is working on housing. That's a very serious issue in Milwaukee, as well around the country.
Yes.
So tell us about Milwaukee County and what services, if we wanted to share this wisdom with our friends, what do we need to know about how we could stay stronger and healthier as a community?
Well, I have a presentation that I can share with you that goes over the services that we provide in aging and disabilities. Mm-hmm. And so I will turn my camera off. Okay. And I will bring up the PowerPoint presentation, and then I will share my screen. Great. So that you can see it. Mm-hmm. Thank you. I may have to go back and see how I can juggle this. Okay. Can everyone see that?
Yes, perfect. Great relief.
Okay. All right. So I am Michelle Allison, and I work for Milwaukee County Department of Health and Human Services, which is referred to as DHHS, and the division that I work in is the Aging and Disability Services Division. Let me see how I gotta move this out the way to go to the next. The Department of Health and Human Services mission is empowering safe, healthy, and meaningful lives. Our vision is together creating healthy communities, and our values are partnership, respect, integrity, diversity, and excellence. Under the Department of Health and Human Services, we have 6 service areas: aging and disability services, behavioral health services, children, youth, and family services, housing services, management services, and veteran services. The Aging and Disability Services primary goal is to empower safe, healthy, and meaningful lives by connecting older adults and individuals with disabilities to resources that promote independence and inclusion, giving them choices for living in and giving to our community. Under our Aging and Disability Services program, we have 5 core areas. There's the Aging and Disability Resource Center, the Adult Protective Services, the Area Agency on Aging. We have IDAP, Burial, and GoPass, as well as the Office for Persons with Disabilities. We're going to start off with the Aging and Disability Resource Center Information and Assistance. The Aging and Disability Resource Center, which is also known by ADRC, which is a national focus that's throughout, like I said, throughout the county, where each county has their own ADRC in Wisconsin and throughout the United States. And it is the first place to go to get accurate, unbiased information on all aspects of life related to aging or living with a disability. The ADRC offers information, referrals, consultations, and assistance regarding access to short and long-term care services for older adults and people with disabilities living in Milwaukee County. The core services of the ADRC are information and assistance, options counseling, benefit specialist programs, youth transition, dementia care, and then there's access to community programs. Per the scope of services established by the Department of Health and Human Service Division of Public Health, the ADRC must provide information and assistance to members of the target populations and their families, friends, caregivers, advocates, and others who ask for assistance on their behalf. Information and assistance must be provided in a manner convenient to the customer, including but not limited to being provided in person, services in the home, in the customer's home, or at the ADRC office as an appointment or a walk-in, over the telephone, virtually, via email, or through written correspondence. Professional referrals are also accepted. Providing information and assistance includes listening to the individual, assessing their needs and strengths, and assisting individuals to connect with service providers or information to support their goals. And so we try to meet our customers where they are with whatever needs they may have. In addition to providing information and assistance, the INA staff can help with completing referrals. And I'm not going to read all the smaller individual items, but we can help with completing referrals for our various service areas and our programs. We can help with referrals to our other areas, such as dementia care or benefit specialists or options counseling. We can complete referrals to other departments within the Department of Health and Human Services, such as adult protective services, brief services, behavioral health services, coordinated entry, and then other external community partners. We also maintain a resource database with guides and tools to use for our ADRC staff. Are there any questions about that portion of the presentation?
I had no idea that all this was available to us. Thank you so much. Wow, Michelle. That's really important stuff. And I hope I didn't miss it, but did you talk about vision?
I'm going to continue with the presentation.
Great.
I'm just gonna stop and ask, are there any questions in the middle
Right.
about what I just covered? When you
Excellent.
mean vision, do you mean vision as in eye care or vision as in our vision for the county?
Those are both important. I mean, eye care for elders who are driving, who should have had their glasses updated.
I'm going to cover that when it gets to our area agency on aging.
Beautiful.
That's
Yep.
going to go over some of that information. We don't quite have any vision coverage or vision programs, but we will refer you to some of the partners that we work with that
Sounds
can
great.
help with individuals that need vision screenings.
Thank you.
So our next area is going to be the Aging and Disability Resource Center Option Counseling. Option counseling is one-on-one consultation about privately and publicly funded long-term care options to allow each individual to make the best informed decision for their needs. Long-term care is ongoing assistance with basic activities of daily life, such as eating, bathing, dressing, or getting in and out of bed. We have experts who can help you understand your options and connect you with resources to meet your long-term care needs. Our referral process is pretty simple. Referrals can be initiated by calling 289-6874. That's a 414 area code to speak to one of our information and assistance professionals. Referrals can also be made by or initiated by the individual or their legal decision maker, and that legal decision maker must have documentation unless they are being referred by staff at a skilled nursing facility or if there are some other special circumstances. Customers or legal decision makers will be contacted by their assigned options counselor within 5 to 10 business days after the initial referral is entered. And then if they are seeking enrollment into publicly funded long-term care program, they should anticipate that the process may take 30 to 60 days. Some of the information that is required is on the screen. It's basic demographics, a summary of customer goals, of the customer's care needs, medical concerns, any legal decision makers and their status, their living situation, alternative or emergency contact information, income and assets, insurance information, and then a summary of their health and safety concerns if needed. There are two ways that option counselors can assist with the choosing publicly funded long-term care, and that is the functional eligibility and the financial eligibility. When you apply for publicly funded long-term care, you call us to get the process started. We will schedule an appointment to do the functional eligibility screening. And this means that we will be assessing any physical, cognitive, or memory impairments that may be limiting that individual to live independently. Once you are functionally eligible, our staff will work with you to do the necessary paperwork for the financial eligibility process. That information is sent to the state of Wisconsin's Income Maintenance Office, and they will determine the financial eligibility. Once you are found to be both functionally and financially eligible, our office will contact the individual to discuss an enrollment date in one of the long-term care programs of their choice. And these are the four long-term care programs. They're family care, partnership, PACE, and IRIS. Those are the options available for residents in Milwaukee County. We, the ADRC, cannot endorse or recommend any organization, product, or services. Each program is offered by multiple agencies, and we would give you that information so that you would be able to do the research yourself on that agency of your choice. The Aging and Disability Resource Center also has option counselors for youth transitions. Youth transitions assist youth with transitioning from the youth care system to the adult care system. And so if there's a student that is 16, 17, 18, and wants to have their continuous service of care and the resources that they are receiving, we can sit down with the families, with the youth individual, with any vocational group, guardian, school group, and work out a plan. We would sit down and make sure that they know about the services they are able to receive, and then also help with any decision making that that they wish to have resources with, or assistance with, I'm sorry. And so the referral is assigned to an options counselor, and they work with case managers and the option counselors to make sure that the family is notified. We contact them to schedule a visit. We try to coordinate care and have everything ready to go when that visit is scheduled. We work jointly with other agencies as well to ensure that the family receives the services and support that promotes the quality of life to pass to their children. And we have resources that we use, the Living My Dream booklet, and then other community agencies and support groups that we work with to make sure that that goal is met. Our benefits specialist service is also within Milwaukee County Aging and Disability Services. There are 2 benefit specialist programs. We have the disability benefits specialist who works with adults 18 to 59. And then we have the elder benefit specialist that assists adults 60 and older. And those are some of the areas that we can assist with answering questions and solving problems, to things like Medicare, Medicaid, SSI, prescription drug programs, Medigap. We also can assist with giving information on the grievance or appeals process for Medicare, Medicaid, and Social Security. Our elder benefit specialists can get technical assistance from senior law when applicable for cases that may need legal representation. And then we also make referrals to both senior law and legal aid, depending on the type of legal assistance that the individual is looking for. Those services do have income guidelines for consumers to receive assistance. These are some of the areas that our disability benefits specialists, their primary core services. And like I mentioned, they were Social Security, assisting with the initial and reconsideration level of services. If they are requesting assistance at a hearing, we can do that, and then we can provide referral for private attorneys to help. We can help with continuing disability refuse, overpayments, Medicare savings programs and Medicare, prescription drug assistance, food share, insurance issues, also the Affordable Care Act or Marketplace. We assist with housing and utility issues, veterans benefits, referrals to private attorneys for representation, and then referrals to work incentive benefit specialists that they can receive through Independence First or DVR. We can provide advocacy on behalf of individuals when necessary and appropriate. We help identify the client. We assist the client in determining what benefits and services are appropriate. We identify benefits the clients may not be aware of. We follow the wishes of the client, even if it's not in their best interest. We help obtain informed consent before taking action. We do not judge the client's opinions or beliefs, and we interpret the evidence in the most favorable light for the client. Our elder benefit specialists assist with Medicaid, Title 19, Medicare, long-term care, Social Security, SSI, food share, subsidized housing, homestead credit, and consumer law problems. This is a another handout that we have available on our website that gives information for the elder benefits specialist, Medicare counselor, and they can help with all of those areas that are listed. And this is a flyer that we do have available for printout on our website under our resource area. We have dementia care services that are available. We have 2 dementia care specialists that are available to help individuals with dementia and their families and caregivers. They also work in the community to provide resources and support systems for those living with dementia and their caregivers. And so one of the ways, so these are the ways that we support individuals through family consultation, care planning, caregiver support, and then there are research opportunities that do become available. In supporting communities, we have community education classes, we have memory screenings that we can offer, we have business trainings and virtual dementia tours. They currently have some classes that they are hosting. Boost Your Brain and Memory is one of the classes that they are hosting. They are also hosting a Savvy Caregivers class. And then they have some informational classes on various areas of dementia. And I'll show you those classes at the end. Those are being hosted in collaboration with the Oasis Center of Milwaukee Public Schools Recreation. Are there any questions about those areas before I move on to the next section?
I have a question.
Yes.
You mentioned before you got into the dementia care, you talked about decisions that are not in their best interests. Can you give an example of what that might be?
I cannot, because each individual case is unique to itself, and I am also not a benefits specialist. So I would just give a generalized example. Say there is an individual that wants to maybe do some things on their own, but the scope of care states that they should probably have somebody to help them with that care. If that's what that person decides, then we have to go and support what they want to do. We cannot say, yes, you have to do this. No, you can't do this. We can only support that individual's decision. We would give them information and resources to help them carry out what they want to do, but we cannot say or make them do anything that they don't want to do. And once again, this is just a fictitious scenario. I can't say for sure what those situations would be.
No, that's helpful.
Yeah, because you may have somebody that wants to live on their own, but they definitely need a caregiver or somebody to help them be there and support. We can't say, no, you can't stay here. What we would do is give them options, give them resources that may be able to help come in and provide care. If there's a family member that's concerned about the well-being, we could also refer them to our Adult Protective Services unit, which I will be talking about later. And they could sit down and plan a meeting with the family as well to say, it may be in your best interest that you possibly live with somebody. And then if any legal action is needed, they could work with our APS department to get that, if there is some harm or threat of harm, they could work with someone to get those types of changes made.
Thank you.
Michelle.
Thank you. And so our next area is the Area Agency on Aging. And in there, we have access to community programs. We work with a lot of community-based areas to coordinate systems for the delivery of social and other critical services to the community. We provide funding to home and community-based services and programs that affirm the dignity of older adults by supporting their choices for living in and giving to our community. One of our service areas is our wellness programs. We have evidence-based prevention programs offered through Milwaukee County to promote healthy living, independence, and improve the well-being of that individual. We have a list of those classes on our website. They are offered county-wide. Some classes are free. Some classes may have a fee attached based on who's providing that workshop. But these are a list of the classes that we offered. And as I mentioned earlier, Savvy Caregiver and Boost Your Brain and Memory is a class that's offered in collaboration with our Dementia Care Department.
Beautiful.
We do need volunteers. If you know anybody that's interested in being a facilitator, we do have options for training, paid training that is available, and they would just need to contact our Health and Wellness department. Jennifer Lefebvre is the coordinator for our Health and Wellness unit.
What would the volunteers do?
They would be trained on those workshops for the health and wellness workshops that were mentioned. They would be trained on, I don't know if I can go back. Let me go back. They will be trained on these workshops, our evidence-based workshops, and then they will be facilitating that training.
Okay, got it. Thanks.
Mm-hmm. We have senior centers that offer a variety of social, recreational, health, and educational activities. Anyone 50 years and older is welcome. Each site has a monthly activity guide that gives you more information on details, classes, and events. And some of the senior center programming has been modified for COVID-19. There are 5 county-owned senior centers: Clinton Rose, Kelly, McGovern, Washington Park, and Wilson Park. And then there are other senior centers throughout Milwaukee County that are operating and serving seniors with all types of fun activities. I was at one of the senior centers, McGovern, and there's a line dance class that's there. And when I tell you those ladies about danced me under the table, after 2 records, I was exhausted after 2 records, and they were still going. And so I've seen the quilting program. I've seen the guys come in and shoot pool, ladies as well. They have musical classes. They have wonderful computer classes where you can learn how to use computers, tablets, your cell phone. If you're looking at buying one, they can help you with learning the various terminologies and what may be best for you. But they have a plethora of activities. They do trips on a monthly basis to various locations. I know they do outings to like shopping centers, to plays and restaurants. And so the senior centers have a lot to offer. We have senior dining, good food with good friends. The senior dining offers a well-balanced, hot, nutritious meal. There is no cost, but there is a suggested $3 contribution. Basic registration and reservation is needed. And then our monthly specialty ethnic menus and dining site locations can be found on our website, as well as on our Facebook page. This is a map of the dining site locations. And then we also feature something called Senior Dining Dine Out. And I'll show you that on the next slide. This is a list of our locations for our senior dining sites, as well as our dine out site locations. As I indicated earlier, you must be 60 years or older. You do have to make a reservation by calling or visiting the site that you want to go to. There is a suggested contribution. However, no eligible senior will be denied participation because of the inability to pay or contribute. And if you need more information, you can call our senior dining number, 414-289-6995, as well as go to our Facebook page or our website. These are our dine out locations. Our newest restaurant that is participating with us is Pass the Peas. They have a lunch that they offer every Tuesday. That lunch is a drive-through pickup. We have Orinda that offers breakfast, a healthy breakfast through the School Sisters of St. Francis. We have Antigua that offers lunch at their restaurant. And then we have Daddy Soul Food on Thursdays that offers a dinner option through Greater Galilee Church. We also have a variety of specialty and ethnic menus at the Elks Lodge, Greater Galilee, the Indian Council for the Elderly, Milwaukee Christian Center, the Milwaukee LGBT Community Center, the Muslim Community Center, United Community Center, and the Water Tower View has a COVID pause on it at this time. Meals on Wheels is a program that's offered for individuals who are 60 and older, Milwaukee County resident, and they must be homebound older adults that are unable to physically or cognitively cook for themselves. They offer a hot, nutritious meal that's delivered to their home Monday through Friday. There is no cost, once again, but a suggested contribution. And then it provides nutrition as well as a connection for those that are isolated. It's an opportunity for somebody to come to the door every day and check on them. Hey, how you doing? You know, see a friendly face. Sometimes if they order a meal and the driver gets to the door to deliver a meal and that person isn't answering the door, that's an opportunity for us to do a deeper dive and to make sure that person is okay. We can let the apartment manager know, or we can contact our senior dining office and have them do follow-up phone calls to make sure that everything is okay and no additional services or no additional assistance is required. We have transportation services. As people age, transportation gets more and more difficult. We connect older adults and adults with disabilities with transportation options so that you can get where you need to go. We have our Go Pass program. We have our Milwaukee County Older Adults Services, OATS. We have Transit Plus, volunteer drivers through ARIS, and then transportation for veterans. And this is just a bit of information on what's required. For Go Pass, you have to be a financially eligible senior, 65 and older, or a person with a disability. It's unlimited rides on the bus for $2 a day. Transit Plus helps with individuals with a disabling illness or a condition that prevents them from using the bus. That has to be verified by a doctor. They provide van rides to any location in Milwaukee County, and the cost is $4 each way, and the ride must be scheduled in advance. There is a fare that may, for those enrolled in long-term care programs, that may be a little bit higher. And then there are handicap accessible vans that are available. Our Milwaukee County OATS program is for individuals 60 and older. They provide transit vans for rides to a variety of locations. The cost for healthcare or dental appointments is $4 each way. And the cost for all other rides, such as to our senior dining site, our county-owned senior center, our wellness programs, our polling locations, and our grocery shopping, is a voluntary contribution of $4 per trip to support the services. Once again, accessible vans are available. Then there are other options such as Family Care PACE and Partnership, Medicaid, Title 19, Veteran Services, and then volunteer drivers. For advocacy, there are times when older adults need someone to advocate on their behalf, and these are some of the agencies that we work with for advocacy. The Senior Law Program, the LGBT Community Center, and then the Ombudsman Program works with those applying for long-term care programs. We have an opportunity, if anybody is interested in becoming a Commission on Aging, a committee member, a council member, on our governing board. There are lots of opportunities for people to take active position in advocating for seniors and individuals with disabilities. And these are some of the areas that we have those committees and councils and boards on. And I can also show you, this information is also on our website. If you ever want to attend any of these meetings, those meetings are public and they are virtual, and you can find that information on the Milwaukee County website as well. Are there any questions about the area on aging before I go on to our adult protective services?
You're doing great, Michelle.
Thank you. So our Adult Protective Service Unit investigates allegations of financial exploitation, neglect, self-neglect, emotional abuse, and physical abuse of adults ages 60 or over, or any adult with a disability. Our Adult Protective Services is not a crisis response unit. If it's an emergency, we have asked you to call 911 or call your local law enforcement agency. All referrals are kept anonymous. And the values for APS is adults have the right to be safe. Adults have the right to retain all of their civil and constitutional rights unless a court adjudicates otherwise. Adults have the right to make decisions that do not conform with the I'm having a hard time saying this, societal norms, as long as these decisions do not harm others. And adults have the right to accept or refuse services. The Adult Protective Services overview are court-related services, guardianship, protective placement, court comprehensive evaluations, prevention services. And in order to make a referral, you can use the online form or you can call us. And once again, all referrals are anonymous. Once the referral is received, we assess the risk level and the competency. We partner with the client and a team to determine what protective services are needed. And then we petition the court for protective services if that's what's required. And those are some of the tools that we use: the Wisconsin Statute for Investigations, protective services, court orders for decision makers and protection, and the limitations are self-determination. Once again, it is something that they have to want for themselves and agree to. If they do not want it, we can't force them to receive it unless it is something that is harmful to their well-being. And so if you are concerned, please give us a call. Once again, the areas are self-neglect, neglect by others, physical abuse, financial abuse, sexual abuse, and emotional abuse. We do have an interim disability assistance program, IDAP, and our burial assistance. IDAP provides a monthly payment to people for financially needed residents 18 and older, or married couples without children who are unable to work due to a disability and have a high probability of receiving federal Social Security SSI. It is an interest-free loan and it has to be repaid. So that is the main thing that people really need to be aware of. They can only be considered if they have been denied. Eligibility will end 18 months from the date of approval or when Social Security approves or denies their SSI application, whichever comes first. And the applicant must reside in Milwaukee County for at least 60 days consecutively with intent of remaining in Milwaukee County. What's needed to apply is the denial letter, their evidence of citizenship, and an acceptable medical documentation, health or chronic disability of a condition that is expected to last or has lasted 12 months or more, or is expected to end in death and prevents the person from performing any type of work. Our burial assistance program provides financial assistance to indigent Milwaukee County residents who are not eligible for state of Wisconsin burial assistance. The descendant must meet a 60-day residency requirement, meet the income and asset guidelines, and have burial costs not to exceed $2,500 for a funeral and $1,500 for burial or cremation, respectively. We are aware that some of these costs are higher, and so they may be able to work with you on that guideline. But they would just need to fill out the application. And they will receive $200 for a funeral or $200 for a burial or $200 for cremation. They will contact our burial assistance program. This also is on our website. Our last area is Office of Persons with Disabilities. Our Office of Persons with Disabilities make information accessible. We support employment for people with disabilities. We support accessible recreation for people with disabilities. We rent accessible recreation facilities to the public, and we receive guidance and implement change. Some of our areas of focus for accessibility, we have sign language interpreters. We have language interpretation services. We provide auditory listening devices. We can provide materials in alternative formats such as Braille or large print. And we have a handy news and notes newsletter that's available for the public. For accessible recreation, we have recreational, summer camp, sports tickets, sail away programs, adaptive equipment, and rec room. For removing barriers, we review architectural plans to make buildings more accessible. We help in reviewing departmental procedures and recommend alternatives that support the inclusion of people with disabilities. We promote the American Disability Act by working with ADA compliance. We have an ADA celebration every summer. We can work with the community and collaborate with them on ADA events. And then there's an ADA grievance process that we can help you with going through that procedure if you need to file. Our Willow Way facility rentals are for our Willow Way Grant location, which is on the south side, and our Willow Way Underwood location, which is on the north side. These are handicap accessible facilities that are available for weddings, banquets, meetings, and special events. There's a calendar of availability that's available on our website. You can also get the application there. You can also get fees and rental information on that at that rental site. And I'm gonna see if I can pull that up. I'm gonna come back to that. Are there any questions about the presentation as a whole?
I have to say, I'm amazed. I had no idea of all these services. Truly, I was totally uninformed, and I'm impressed.
If you want to contact us, our general intake line is 414-289-6874. We can be contacted by email, and we can be contacted via our website. And so I'm going to go back and show you the facilities, if the link will work. Hopefully. Let me find new share. Are you able to see that? Hold on. Are you able to see the
Yes.
facility rent? That's one of the facilities. And if you this is where you can see the availability on the calendar. You can complete the application. This is the fees that are available. Hey, pretty. And those are the facility features. And if you click on the picture, I don't know, is it going to? Can you see that?
Yep, I see it.
So that's the outside of the Underwood facility that's in Wauwatosa. And there are some pictures that you can see of the inside areas, as well as the full service kitchen. There's a conference room. They have a waiting pool in the back. They have an accessible playground area, lots of green space. I had a family reunion here and everybody enjoyed it. You can be inside or outside. They do provide picnic tables. They have an area that you can grill out in if need be. And so they're really a good area, good things to promote, and a good space to use. Let me see if I can go to our website in general. May have to bring that one up. Oh, well, we are here on the website. Can you see that? Older Adult Services?
Yep.
go to Milwaukee County, and you will go to the Department of Health. Let me see if it'll
Sure.
to the link. You go to our county, you go to departments and divisions, you go to Department of Health and Human Services, and this is all of the areas that I mentioned earlier. You can go to either seniors or you can go to disabilities. And on our seniors website, you can click here. There's a resource database. You can download the brochures. All the brochures that I talked about in the areas are right here. You would just click on it, and this is the one for burial assistance. You would be able to click on it and just see the information that's available. There's community outreach. If you ever want one of our areas, our dementia care has outreach coordinators. Our health and wellness has outreach coordinators, transportation, Medicare. Those are all presentations that can be done. You can go here and click on the outreach request form. The dementia care specialist can come do memory screenings. You would just put in that request. It would come directly to me, and I would be able to give that to them so that they can help coordinate that care. Here's our advocacy area that talks about all the advocacy committees. And here you can go here to find out our meetings, what our priorities are, what's in the budget. We have a senior leadership program that we offer every year in May, where individuals can come and learn more about being a leader. Here's information on our boards and our other committees with the full description. The meeting minutes is here. We can go to the main page to get news on some of the information that we have coming up. We have a tour of the domes, which is available if anybody wants to get out and tour the domes. On Thursdays, they have tours from 9 to 10:30. And to find about our meals are here. You can go to our dining menu, and all of our menus are listed here. Here's the dining flyer that gives you the locations and general information. And the dine out menu flyer is here. Antigua, Daddy Soul Food. Let's see, tomorrow is the 23rd. Oh, 2 days from now. So they're going to be having meatloaf, mashed potatoes, and corn. Antigua and Orinda always have the same menu. Pastor Peas is going to have today split chicken breast, candied yams, green beans, bread, fresh fruit, and milk. And so all of our menus are here. Our Meals on Wheels menu is here. We try to put the menu out for the month current and the month ahead. We even have a menu on here that kind of gives highlights of the different locations. And so each location here is mentioned and what they're going to be having on that day. But you can see the variety of ethnic meals that we have. You can see the variety of locations, and then the options for dine out. But any information that you need really pretty much is on our website. If you want to sign up for long-term care, there's more information here about publicly funded long-term care. Our dementia department has a page as well if you want to connect with one of their specialists. And so we have a lot of supports. There's a lot of resources out here. If you go back to our main page, transportation is here. There's our transportation options. And then here's our health and wellness classes. So if you want to sign up for the Boost Your Brain and Memory, they have a virtual class starting March 27th. And you would just go here and click on to register, or you can give a call. Like I said, some of them have classes. Some of them may not have classes at this time. Living with Diabetes has a workshop coming up starting March 21st. Living with Chronic Conditions. And here it would tell you whether or not there's a cost for participation and the locations that it's being held at. Some are virtual or some are in person. Are there any other questions for me?
I just have to say, this is a brilliant presentation. You had to do a lot of talking to share all that knowledge with us. I'll open it up if there's any other questions, but I am very grateful. Thank you. And I'm going to check out that renting at the Will You Way?
Willow Way?
Willow Way.
Right. Me too.
Yeah, on Underwood.
Well, I'd like to say I enjoyed the presentation. Very well delivered, Michelle.
Thank
Soror
you.
Michelle.
Thank
Soror.
you.
And, yes, Patricia, we are in the same sorority. Patricia was talking about sororities yesterday. I left the Wilson Senior Center this early morning. I had my taxes done there, provided by the center through AARP, and people were sitting around with no one to help. So we need to get the word out that there's this free service for seniors over 60.
Yes.
And I really enjoy that place. I told you, I'm missing my aerobics twice a week because of you know who right here in my arm.
Yeah, you're getting a different aerobics.
You sure are.
You're rocking, Renee.
Good to see you,
Okay.
Soror.
Okay.
Yeah, we stay busy at the senior centers, and there's a commission, a committee for the senior centers too. Like I said, if you're interested in taking an active approach in helping to improve what's there and giving suggestions on what they're offering, feedback is also important and appreciated.
Okay.
I have just one other thing to add. I'm concerned about people who are driving with old glasses,
Okay.
meaning they should have updated their prescription. Maybe they think they're going to have cataract surgery and they don't want to invest in their eyes. I found out this week that I'm driving illegally because these glasses needed to be updated.
Wow.
So I was postponing it, and I have the money to get that prescription. So I think about all the people who are on the road who should not be driving. I'm very concerned because they may not have the money to get that vision care. The second one is I am a cadaver donor. So I don't need the burial services, but I hate how people get ripped off with burials. The American way of dying, I think, is terrible. And the exploitation of people, $10,000 to bury someone. So they have to do a GoFundMe to help bury their family. So that was very helpful. But you can also be a cadaver donor, which means my body will go to the medical college. It will cost me $450 to deliver the body wherever I'm from. But something good happens and my family is not going to be ripped off with these high costs of funerals. So Michelle, thank you very much.
Thank you for having me. Feel free, like I said, if you would like to explore any of our other presentations in more depth, if you guys would like to participate in one of the dementia trainings, please reach out and let me know. But I thank you for having me.
Okay, thank you. And thank you, everybody. Any final comments from folks before we leave the meeting?
She's a walking encyclopedia for the Milwaukee County.
That's just one department. So just know that your tax dollars are going to good use.
We do.
Thank you. Thank you so much.
Thank you very much.
Okay, let's remember to get people out voting today. It really matters. Thanks for all of your work. Everyone, stay with it and stay strong.